Hello everyone, this is Mansi Oberoi, second year internal medicine resident at University of South Dakota, Sioux Falls. Thank you for giving me this opportunity of presenting this interesting case of PML, that is progressive multifocal leukoencephalopathy in a patient with chronic lymphocytic leukemia who was not on any chemotherapy. Let's begin by talking what is PML. So it is a rare, highly fatal, demyelinating disease of the central nervous system which is caused by the reactivation of the JC polyoma virus. It occurs almost exclusively in immunosuppressed patients like HIV patients, autoimmune disease, solid organ transplant patients on immunosuppressants, and malignancies treated with chemotherapy. Our patient had CLL but never received any chemotherapy and was found to have PML. So she was a 78-year-old female brought by the family with complaints of fall, progressively worsening confusion, and memory impairment for the past 2 to 3 weeks. She was diagnosed with CLL 4 years back, was under surveillance but never received any chemotherapy. On examination, she was alert and oriented to self but not to place or time, had limited memory of recent events, apparent word finding difficulty, and was following commands inconsistently. Labs revealed leukocytosis with WBC count of 120,000 and mild thrombocytopenia with platelet count of 134,000. A non-contrast CT head was done which revealed no evidence of intracranial bleed but a low-density focus in the left frontal white matter. Therefore, MRI brain with and without contrast was done, which demonstrated areas of patchy hyperintensity in the white matter of both hemispheres, as can be seen in Figure 1 and 2. A lumbar puncture was done and the CSF analysis showed normal WBC count, proteins, but slightly elevated RBC at 2. But the other workup, including the herpes simplex virus, VDRL, Lyme antibodies, and all the cultures, including bacterial, viral, fungal, and AFB, were negative. Interestingly, the CSF PCR came back positive for JC virus. Additional tests, including the HIV virus and autoimmune panels, was done, and they all were negative. So with given her clinical presentation of neurological symptoms, her MRI brain findings with asymmetric white matter lesions on both hemispheres and a positive CSF PCR for JC virus led to the diagnosis of PML. Unfortunately, her symptoms progressively worsened, and due to the fatal nature of the disease and toxic potential of the therapy, a discussion with the family was done and they opted for comfort measures. Now let's talk about the natural history of PML. The primary infection, which is usually asymptomatic, it occurs in the childhood, and the virus remains latent in the lymphoid organs and the kidneys. And on immunosuppression, it reactivates mainly in the glial cells, and the patients manifest with the neurological symptoms like our patient did. So this disease got attention when natalizumab, which is used for the treatment of multiple sclerosis, was reported with the association of this disease. CSF PCR is the preferred approach, but the brain biopsy remains the gold standard, which shows the histopathological triad of demyelination, bizarre astrocytes, and enlarged oligodendrogram nuclei. Unfortunately, there is no definitive treatment for PML till date, and therefore the prognosis of this disease is very poor, with death within 2 to 15 months. Various investigational therapies, including the checkpoint inhibitors, other drugs like cytarabine, mefloquine, have been tried with no proven benefit. So our main approach should be to improve the host adaptive immunity. Like if a patient has HIV, we can optimize the antiretroviral therapy. If he's on immunosuppressants, particularly natalizumab, that drug should be stopped. But this immune reconstitution is difficult and tricky in patients with hematological malignancy, as was the case with our patient. So the key learning objective here is that due to the rapid deterioration and the fatal course, high degree of clinical suspicion for PML should be considered in patients with CLL even if they are not on any chemotherapeutic drugs when they present with the neurological manifestations. And further studies exploring the surveillance strategies and possibility of immune reconstitution in these patients are much needed. Thank you and have a nice day.